Well, it's Tuesday, which means we're joined by some folks from Greenwood Leflore Hospital this morning. Dr. Richard Goldberg, who is a specialist when it comes to one of those things that most people consider a silent, often overlooked thing, colon cancer. How serious and how often can something like this be overlooked?
Well, colon cancer is the third leading cause of cancer death overall. Interestingly enough, colon cancer is one of the cancers that actually can be prevented by screening colonoscopy. Colonoscopy is the gold standard screening test in which people starting at the age of 50 should have done.
Okay. When should, we were talking about this earlier, and I'm just curious. For people that may be under 50, now obviously over 50, you need to start getting checked and coming in and seeing folks. Under 50, are there symptoms that patients may notice, may miss, things that they should be making sure their doctors are aware of?
There can be symptoms, constipation, diarrhea, blood in the stool, anemia, but largely people are asymptomatic, especially early on. So what we found is as colonoscopies have evolved and more people are having colonoscopies, the rate of cancer death is actually decreased.
Wow. That's amazing. Let me ask this. When it comes to families, we hear a lot about, genetics and whatnot. If it's in your family, if it's been in your family, does that put you at a higher place, and do you need to be sure to come in sooner, or?
Absolutely. Most colon cancers are sporadic, meaning they just happen. It's bad luck. The rest of them are genetic linked, and depending on when the index person was diagnosed with colon cancer, is usually 10 years before that is when they begin screening. One of the things I always tell people who have a family history of colon cancer is no matter where you are, every 5 years you have a colonoscopy.
Gotcha. Okay. That was actually my next question. How important is it to consistently get in and be seen? Right. Is just that 5-year time enough, or?
For people with colon cancer history, it is. Okay. It's no more than 5 years. For the average risk person, you hear 10 years, you get one every 10 years, yes and no. You can get one as soon as 3 to 6 months or all the way out to 10 years. Most people fall somewhere in between 3 and 5 years of getting colonoscopy.
Now let me ask this question. Obviously we're talking prevention this morning, but if somebody does contract colon cancer and they end up coming in and you find it, what is their outlook for the future? I mean, is it something that can be taken care of and they're fine, they'll have a healthy, full life? What are things that?
Most people who have a colon cancer found at the time of a colonoscopy have a much better outlook and prognosis than the person who comes in and has a colon cancer found with a perforated bowel or whatnot. So colonoscopy really puts you ahead of the curve. If you're going to have colon cancer, it's found with a colonoscopy, your outlook's much better. Prognosis, expected life expectancy, and whatnot.
A lot better. I think one last thing is when people think about colonoscopy, there's a fear of coming in of what they may find. Any recommendations or suggestions for people that may say, I want to get checked, but there's things that make me afraid of going in for what I might find?
Well, it's like I just said, it's better to find the colon cancer on a colonoscopy so that it can go ahead and be treated. And oftentimes when we find them at a colonoscopy, they don't even require chemotherapy or radiation. Wow. Oftentimes it's not always, but finding it early is certainly beneficial.
A greater chance. Get in early, make sure to take care of it, and then you're off to better starts.
That's right.
Fantastic. Thanks so much for being here this morning.
Thanks for having me.
Stay with us. We have more Good Morning Mississippi coming up when we return.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.